Hello all, my name is Kaden Lindstrom. This is a clinic test for Grand Canyon University. Let's get right into it. I'm a nurse working at a clinic and my patient Jane Doe comes in concerned. She is very healthy for her age, which is 25. She's 5'2", 120 pounds, female and African American. However, she is experiencing lots of fatigue. She's not wanting to leave her bed or do the things that she does on the daily. She doesn't have the energy for it. And when she does leave the bed, it is for frequent urination, which is abnormal for her. Most importantly, her legs and feet are swollen. Now, this all to me are symptoms of kidney disease. However, the fatigue and frequent urination are also common symptoms for UTI and diabetes. So that I can rule out those other possibilities and confirm or deny my suspicions, I'm going to be conducting a glucose test, urinalysis, and looking at her enzyme kinetics. Starting with the glucose test, we're going to be using a glucose meter where I will place a drop of her blood on a glucose strip. This is attached to a glucometer, which will then read the sugar level to me. I'll also be doing a Benedict's test, which is a mixture already containing copper and aldehyde, but once a sample of her urine is added, it will change the color and let me know what that glucose level is. Lastly, I will be taking a sample of her urine and putting it on a glucose strip, which will also give me a third sugar level. That way we can make sure all of our numbers are correct. All of the pictures on the bottom correspond with the tests that are pictured above them. The results I got from this is that her glucose levels are slightly elevated. Her blood glucose was 120, her Benedict's test turned green, and the strip from the urine sample turned a green-brown color. That being said, this increases our suspicion for either kidney disease or diabetes. In order to either confirm or deny diabetes, we are then going to do a test on her enzyme kinetics. Now, why are we testing this? Enzyme kinetics are responsible for our metabolic pathways, or our metabolic pathways rely on them. They break down food into fuel and produce energy. If we have a lack of them, it can result in pronounced insulin resistance and glucose intolerance, which are common symptoms of diabetes. To test this, we will take more samples of her urine and blood, and her levels, which are pictured on the right, did come out normal. This means that she more than likely does not have diabetes, but something is causing that blood sugar level to be elevated. So now that we've ruled out diabetes, we need to test for a possible UTI. So we will be conducting 4 series of tests for urinalysis. These, as in the name, all use samples of her urine to confirm. We're going to be starting with a protein test, which is pictured on the right top. We'll be taking her urine and boiling it, looking for a formation of precipitation. And her levels did come back abnormal, as pictured in the right. Underneath that, we will have a pH strip test where we put a sample of her urine on. It came back purple, which is abnormally low. At the very bottom, we have our ketone strip test, also using her urine. The levels for that came back normal. And on the very right, similar to our Benedict's test, we're going to be observing for a color change with our Ehrlich's test. And those levels came back normal as well. So, from everything we've done, what do we know? We know her blood sugar is high. But we also know that her enzymes were normal, which means it is not diabetes. We know that her blood pressure is also high. She has abnormal protein levels and low pH levels. So elevated blood sugar is a symptom of kidney disease. Abnormal protein levels is also a symptom because this disease can make it to where the body is unable to remove waste from a protein as it normally would. That means that it could be high or low. And lastly, low pH levels, I also found in my research, is another common factor of kidney disease. So we have to tell Jane Doe that she has kidney disease, and she's going to ask us, okay, what can I do about it? So we'll give her treatment plan. Unfortunately, kidney disease doesn't have a cure, but our patient is 25 years old. She's still young, so we're going to do what we can to preserve her kidney to functioning in the way that it normally would. First of all, I'm going to recommend a protein diet. As seen before in our research, it makes it to where the body is unable to remove waste from protein. So by keeping her protein diet low, we are not going to risk any high levels that we were experiencing beforehand. I'm also going to ask Jane Doe to keep track of her blood pressure and blood sugar, and I will as well, because of course I'm going to recommend that she comes back to the clinic. That way, if she does need prescriptions to help manage those, that is something that I can get for her. And more importantly, as recommended with most things, I'm going to tell her to stay active. That is going to help the body the most. So if she has a lifestyle where maybe she is at home a lot, I'm going to recommend her trying to go outside more, maybe find a sport that she enjoys, or try to go into the gym a couple days a week. It is important that she stays active. And as I mentioned before, following up on clinic visits. That way I can make sure that we are maintaining a good blood pressure and blood sugar. If there are any other issues that come to light, I will be the first to know. And we can find different ways to combat future problems, make sure things aren't getting worse before they can get better. And lastly, I have my references. The results that she got, I looked up all related to kidney disease, which are listed at the top and at the very bottom. If you're curious about how to find symptoms and symptoms and treatments of kidney disease, I got that from Cleveland Clinic Medical. Thank you so much and have a wonderful day.